Americans are good people with generous spirits, but too often we're captured by the propaganda and sound bites of corporate-owned media. And we don't vote, but worse, we don't protest. So we pay 2.5 times for health care as the British. We live 5 fewer years than the Japanese, and we lose twice as many infants as the Germans. We let corporations make huge profits on our sickness. We let corporate lobbyists buy our lawmakers. And we refuse to make politicians accountable. In a nutshell, 4 problems have broken our health system: cost, complexity, corruption, and complicity. Let's look at the cost problem. 1. Before 1,300 U.S. private plans pay for treatment, they first pay for administration, offices, computers, outrageous executive salaries, lobbying, advertising, and profits. Private plans pay 30% for administration. Medicare, 3%. 2. Before your doctor, hospital, drug, or medical device company gives a medical product or service, they too must pay their administration. Our 900,000 doctors, for example, pay an average of $88,000 a year just to communicate with the massive private health plans bureaucracy. 3. Drug gouging. In 2015, it was estimated that Medicare would spend $87 billion on drugs, but is not allowed to negotiate lower prices. The VA negotiates and pays 40% less. So do Norway, Canada, and dozens of other countries. Americans pay outrageous drug prices, like $750 for a Daraprim pill, $42 for one Viagra pill, and $247 for 100 Prozac pills that cost 11 cents for the active ingredients in all 100 pills. 4. Greed and fraud often trump the do not harm Hippocratic oath in a system charging whatever the market will bear. A friend was charged $45,000 for an ambulance ride from Yosemite to a 2-day hospital stay in Modesto. Implanting a pacemaker in Ohio can cost $19,000. In Wisconsin, $96,000. And pharmaceutical companies can stop producing a needed drug if profit is too low. Ralph Nader tells us that as much as $300 billion, or 10% of $3 trillion, is bilked annually from the health system in false claims and other scams. Cost of health care per person in the U.S. in 2013 was over $9,000. In England, it was $3,400. How much of the $5,700 difference is greed or fraud? How much of it was earned from denying coverage to sick children or blocking critical treatment to adults? And will someone please tell me why, when our government pays over $8 million per day to support Israel, why Americans must hold fundraisers or go bankrupt to pay medical bills? 5. Family bankruptcies. A Harvard study indicated medical expense is the cause of 62% of all personal bankruptcies, and 78% had some form of health insurance. In the last 5 years, there have been almost 6 million personal bankruptcies. In 1960, U.S. healthcare was 5% of GDP. By 2012, it snowballed to 17%. 17%, and our infant death rate is 55th in the world, far worse than Cuba, Slovenia, or South Korea. Let's look at complexity. The U.S. has a massive private health bureaucracy of 1,300 private plans. It is impossible to understand and compare plans. copays, deductibles, formularies, donut holes, Parts A, B, C, and D, Medicaid, Medicare, Medicare Advantage, affordable care, rate corridors, insurance exchanges. The system is so complex, doctors hire 2 to 3 staff simply to connect to medical plans. And who do we hire?